Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center. I'm going to walk you through a Vaser Liposuction and BodyTite procedure on a stomach. This is a patient who's had a few children, so her skin is also a bit loose along with carrying a little bit of excess fat, and that's why we're using BodyTite to further tighten the skin. I've just numbed a little area around her umbilicus, and this is where I'm going to then make a puncture through the skin using a small blade. This is such a small puncture, it usually closes up within 24 to 48 hours without requiring any kind of stitches. Next, I'm tumescing her skin, and this is the infusion using an infusion cannula which is a blunt probe, and we're basically dispersing an anesthetic solution throughout the fat areas, and this is comprised of lidocaine, which is an anesthetic, along with some sodium bicarb and epinephrine. And I'm just making sure that I'm getting all the layers and have now finished tumescing. You can see that the skin has turned kind of a whitish color, and that helps to reduce the amount of bleeding that occurs. And it is also nicely firmed up. Now I'm using the BodyTite cannula here, and this is again a blunt probe that delivers radiofrequency energy under the skin at a very precise temperature. So our target is about 65 degrees Celsius. This helps to kill fat and also tighten the fibrous connective tissue and build new collagen. We actually will see some of the effect immediately, but it actually continues to get better and better and tighter over the next 12 months after the procedure. So I'm going to, this is a very slow procedure, but we're just uniformly heating, trying to get that 65 degrees under the skin, and then about, we try to reach 40 to 42 degrees Celsius at the skin level, which is a good target temperature for the skin. Now I'm using the Vaser probe, which is focused ultrasound, and this is starting to liquefy all the remaining fat that the BodyTite procedure did not kill yet. And you can see that creamy fat just starting to pool at the insertion point. And I'm just going around through all the different areas, making sure that we have killed all the fat. Sometimes all we need to do is the Vaser liposuction procedure. We don't always have to combine it with BodyTite, but in this case, because of the laxity in the skin and wanting to get a little bit more firming without the patient requiring to undergo a tummy tuck type of procedure, the BodyTite can be especially helpful in helping us accomplish more of the tightening as well as removing the fat. And here we are suctioning the fat out now. You can, if you look at the tube next to the body there, you can see the fat starting to come out. And again, I'm just going to go through the deep to superficial layers and make sure that we have a nice uniform removal of the fat. And then the patient will wear a compression garment for usually about a month in total, but for the first 72 hours, you want to leave it on pretty much continuously. And the excess fluid continues to drain from the little puncture sites for about, like I said, 24 to 48 hours. The puncture sites close up. And there's really not that much discomfort from this procedure, believe it or not. Here you can see the lovely fat that's coming out from this patient's belly. And it's a very satisfying procedure. So we absolutely love doing it. Please ask us any questions and let us know what you think in the comments. Thank you so much for watching.